Hello friends, I am Dr. Naveen Koval, and here is a medical mnemonic to remember Bruton's X-linked Agammaglobulinemia. Okay, I'm sure you must have heard about this disease. It's a primary immune deficiency, predominantly affecting the B cells. Now let us see some of the important points related to Bruton's X-linked Agammaglobulinemia that will help you to solve certain MCQs. So you can see that the word itself has certain findings. Okay, like the word itself has mentioned that it's X-linked disease and it has agammaglobulinemia. That means it's an X-linked recessive disorder, therefore it will be predominantly affecting the boys, and also it is having agammaglobulinemia. That means the antibodies are absent or deficient in this particular condition. Okay, so X-linked agammaglobulinemia. Now there are few other points that you have to remember. Okay, so how do you remember that? Just think of this word Bruton's X. Okay, the word itself has TONS and X, tons X. That means the tonsils will be absent in this particular condition. So if you get a case where the child is having absence of tonsils, you have to think about this disease. Okay, another point that you can think is X-linked. That already I told you one point about the X-linked, that it's transmitted as an X-linked recessive disorder. Another point that you have to remember is the X-linked, the word itself has that L and N. That means the lymph nodes will be absent. Okay, so the absent lymph node is another finding that you will get in a case of Bruton's X-linked agammaglobulinemia. So absent lymph nodes is another finding. So tonsils are absent, lymph nodes are absent, antibodies are absent, and it's X-linked recessive condition. Okay, and one more thing is it's a Bruton's X. When you're writing Bruton's X, it's B and X. That means the B cells. Okay, the B cells are absent. You already know that B cells are the ones that produces the antibodies. So in this condition, the B cells are getting affected, and therefore the antibody production is getting affected. And because of that consequence, the child will be having recurrent infections. Okay, so now you already know that it's X-linked recessive condition having agammaglobulinemia, B cell absence, along with the absence of lymph nodes and tonsils. There are certain other additional points that you have to remember from an MCQ point of view, also from a clinician's point of view. For that, you just remember the word B. Okay, so what are the things that you can connect with the word B to get the clue regarding Bruton's X-linked agammaglobulinemia? The most important thing is the gene. Okay, so the BTK gene. So gene that is predominantly getting affected in the case of Bruton's X-linked agammaglobulinemia with the BTK gene. So BTK gene mutation, if it's given in the MCQ, the STEM, the answer should be Bruton's X-linked agammaglobulinemia. Okay. The another point that you have to remember is that there will be history of recurrent bacterial infections. So obviously there is absence of antibodies, so the child will be prone for bacterial infection. Okay. So if a child comes to you with a history of recurrent bacterial infections, okay, and you find that during the inspection you are unable to see the lymph nodes, okay, and also the tonsils are absent, that means that you have to think of Bruton's X-linked agammaglobulinemia. Okay, another thing you have to remember with the word B is that they are predominantly seen in boys. I told you it's X-linked recessive disorder, so you already know that it's predominantly seen in boys. So the MCQ will be like, a boy come to you, okay, with a history of recurrent bacterial infection. On examination, you find out the tonsils are absent, the lymph nodes are absent. Okay, on investigation, you find out that the antibodies are absent, B cells are absent in the bone marrow. Then that will be the clue for Bruton's X-linked agammaglobulinemia. Okay, few other facts that can be connected with the B is the onset, that is begins after 6 months of age. So begins, this also 6 looks like a B. So what is the reason for that? For the first 6 months of age, there are maternal antibodies present inside the baby, and that will be helpful, or that will be protecting the child from the recurrent infections. So it will manifest only after the age of 6 months. So the history will be like, the 6-month-old boy comes to you with a history of recurrent bacterial infection. On examination, you find that tonsils are absent, the lymph nodes are absent. Investigation, you find that antibodies are absent, B cells are absent. So this will be your typical history that you get in a case of Bruton's X-linked agammaglobulinemia. Another B also means that one important point that you have to remember is that when you give an OPV to children suffering from Bruton's X-linked agammaglobulinemia, there is a chance that the child may go into paralysis. So if you find that in the MCQ there is anywhere it's mentioned that a child comes to you with a history of paralysis after intake of OPV, live OPV, that is an oral OPV, that's a bivalent OPV, then you have to think of Bruton's X-linked agammaglobulinemia. Okay, and the final point that you can remember is, final point will be the absence of antibodies that you already know. Okay, so these are the most important points that you have to remember about Bruton's X-linked agammaglobulinemia. I'm sure that if any MCQ is asked about this condition, I'm sure you'll be able to answer most of the answers related to that. Okay, and not only from an examination point of view, also as a perspective of clinician, when you're seeing such a child in the OP, okay, you should think of all these points when you're examining the child. Okay, so to summarize, what are the things that you have to look for? So Bruton's X-linked agammaglobulinemia is a primary immune deficiency predominantly affecting the B cells, is an X-linked recessive disorder, and agammaglobulinemia means decreased antibodies or absent antibodies. Bruton's X, it has tonsils are absent, lymph nodes are absent, the B cells are absent. The gene predominantly that is mutated in this condition will be BTK gene. The child will be presenting, that's a boy, more than 6 months of age, will present with a recurrent bacterial infection, and there will be also a history of paralysis following live OPV. Okay, there is a bivalent OPV. So these are some of the things that you can correlate and answer, okay, in your exam. I'm sure after this video you'll be able to answer most of the MCQs related to Bruton's X-linked agammaglobulinemia. If you found this video helpful, please like this video and share it with your friends. Thank you and happy learning.